We all know regular health checkups are important, but after the age of 70, not all tests bring benefits. In fact, some can cause more harm than help. As we get older, the focus of healthcare should shift from simply finding diseases to preserving quality of life, avoiding unnecessary risks, and preventing stressful or harmful procedures. There are 5 common health checkups that seniors over 70 should think twice about before agreeing to. First is the routine colonoscopy. This procedure can be life-saving earlier in life, but after age 70 to 75, especially if you've had normal results in the past, the benefits drop significantly. The risks, however, increase, including bleeding, bowel perforation, and complications from anesthesia. At this age, it may be safer to consider less invasive stool-based tests instead. Second is PSA testing for prostate cancer in older men. While early detection sounds good, PSA tests often lead to overdiagnosis, finding cancers that are so slow-growing they would never cause harm during your lifetime. The problem is, once detected, these cancers can trigger a cascade of biopsies, infections, and treatments with side effects that impact your quality of life. For many men over 70, the risks outweigh the benefits, unless you have symptoms or a strong medical reason to continue testing. Third is the so-called full-body scan. It might sound thorough to get a CT or MRI scan from head to toe, but for most healthy seniors, it's not helpful. CT scans expose you to high doses of radiation, and both CT and MRI scans often pick up harmless abnormalities that lead to more tests, more anxiety, and sometimes unnecessary surgeries. Unless your doctor is investigating a specific problem, a full-body scan is rarely worth the potential downsides. Fourth is bone density testing done too often. Bone density scans are useful for diagnosing osteoporosis, but once you have your baseline results after 70, you usually don't need them every year. Overtesting can lead to overuse of medications that carry their own risks, such as jawbone problems or unusual fractures. In most cases, repeating the test every 2 to 5 years is enough, unless you've had a major health change or a fracture. Finally, aggressive cancer screenings without symptoms can do more harm than good. Screening for breast, cervical, or lung cancer has its place, but after 70, if you're low risk and symptom-free, the chances of false positives, unnecessary biopsies, and treatments with serious side effects go up. These can cause stress, pain, and even shorten your lifespan instead of extending it. The key is to discuss with your doctor whether continued screening will truly improve your health outcomes or simply add more medical appointments and worry. After 70, the smartest approach to healthcare is not just to look for problems, but to make sure every test you do has a clear benefit for your well-being. Sometimes, saying no to a test is the best decision you can make for a longer, happier, and more comfortable life. Always have an open conversation with your doctor, weigh the pros and cons, and remember, more tests don't always mean better health.